The longest tenured employee in the history of Sanford Health recently retired in Laverne, Minnesota. Eric Thorstensen introduces us to Carol Wieneke, this week's Someone You Should Know.
Carol Wieneke started working as a nurse in Laverne 60 years ago.
I graduated from nursing school in August of 1963. In November, my high school friend called me one day and asked if I was looking for a job, and I said, yeah. She said, well, she was working in Laverne at a medical center and they were looking for a nurse.
That led to an interview for Carol.
I went without a resume. I had no references. I had no application, nothing.
And she got the job.
I started at 90 cents an hour.
Over those 6 decades, she's done it all at Sanford Laverne. Working with patients to more of an administrative job of scheduling in recent years.
I never had a day where I'd get up in the morning and say, oh, I just don't want to go to work today. I have bonded with many people. I don't know if I could ever name every person that I have worked with. It'd be a long list, but I've stayed friends with many of those girls. Even the physicians, you stay friends with them. Quiet this morning because you work together side by side.
It's just really awesome.
Day after day.
Able to say that you've been at one job.
You really get to know each other. Not a lot of places to move on to.
Right.
She takes care of us and herself and her family, and she just genuinely always works hard.
There's so many opportunities.
And she's seen a lot of changes in healthcare.
When I started, we didn't have the equipment or the technology that we have now. So as time went, you saw it progress to ultrasounds, specific x-rays, MRIs, everything. Mammograms, I don't really think there were mammograms when I started 60 years ago. Then we got into the measles, then we went to mumps, went chicken pox, and now we've got RSV, we've got pneumonia, we've got COVID. It's amazing all the new vaccines that have been brought forward.
While some things have never changed.
It is the fulfillment that you get the satisfaction of how you have helped someone. Even if there's grieving, you know, there's so much that you can do by just talking to someone, giving them a hug.
She'll still find plenty of things to do in retirement.
I've got 3 children, 6 grandchildren, and 1 great-grandchild.
She deserves to finally retire and enjoy things because this is a lot, but we're really going to miss her. She's great.
Never have been sorry, ever. Worked out perfect.
In Laverne, Eric Thorstensen, Dakota News Now.
Another interesting fact here, Medicare and Medicaid didn't exist when Carol started as a nurse back in 1963. If there's someone you think we should know, email us a nomination. Send that to news@dakotanewsnow.com.